People with severe sinus problems know that relief doesn't come from a pill or a nasal spray, but now there is an advanced outpatient procedure called Balloon Sinuplasty that will get you back to work the next day. And our next guest was the first medical practice to offer this advanced technology here in Wisconsin. And welcome back to Dr. Madan Kandula from the Advanced Ear, Nose, and Throat Specialist. And he brought along a patient, Michael Deemer. Thanks for being with us, gentlemen, today.
Thank you. Good morning.
I have a particular interest in this selfishly because I've had 3 sinus infections since October. I talk to more people every day. Once you're sort of open to the sinus world, you know, you realize how many people are really bummed out by this.
Exactly.
And how painful it can be and how much it interferes with the quality of your life. And I found a neti pot. So I'm sitting there with this, you know, dumping water down my nose, and my husband's like, what is going on there? It's disgusting. You know, so, you know, people really do have problems with this.
Absolutely. Absolutely. Yeah, it's one of the, it's out of the patients I see, the patients who are chronically suffer from chronic sinus infections are probably the most miserable out there. And, you know, the good thing nowadays, we've got some really nice techniques, including sinuplasty, which really can help them.
Because the sinus surgery is really not the be-all, end-all, right?
Right. I mean, there's some people who absolutely that's what they need to have done to make things work for them. Other people are not that bad off. And what we're trying to do with sinuplasty is just open the natural sinus openings. For instance, things like the neti pot tend to work better when they're actually able to rinse your sinuses out.
Yeah, right. When you have something that you can move.
Exactly.
But it can actually become so blocked that you can't even move it.
Exactly.
Right?
Yeah.
Okay.
Exactly. Either it's completely blocked off, or it can be partially blocked off. And then if you get a cold or even allergies that kick in, then it becomes completely blocked off, and then you're trapped.
And this woman that we saw as a patient, Michael, you've had this experience. How severe was your problem?
It was almost debilitating. It was very difficult to even get through some days a couple of years ago.
Did you? Well, she was describing this pain in her throat and all through the jaw and all that. Was that affecting you to that level?
Yeah, it was a combination of things. It was foggy-headedness, difficulty to concentrate, and I would have severe migraines almost weekly.
That's awful. And sleep, I bet, was awful.
Yeah, well, waking up in the morning and not feeling rested, waking up and feeling like you hadn't gotten a good night's sleep, even though I was sleeping sometimes 9-10 hours.
And you just never really felt good.
Exactly.
Were you taking antibiotics then a lot?
No, I really hadn't seen an ENT for a while, just because I hadn't gotten any relief. Or if I saw people, they said, well, there's nothing we can really do for you. And you run into a lot of people when you describe what you're going through,
Absolutely.
and they hear the same thing. They
Right.
just keep hearing over and over, there's nothing we can do for you.
Right.
And I heard that for years.
And Dr. Kandula, you want to show us how the balloon sinuplasty works?
Right. Yeah, we've brought in animation, so this is this will kind of demonstrate what's happening. So this is, you know, a mock-up of a patient's head right here, and that's actually the little catheter that we introduced through the nose. So this is done completely through the nose, typically when somebody's asleep. It usually takes about 5 or 10 minutes to do. And what we're doing with that is putting the catheter up into the nose, up to where the sinus openings are. And then all that we do with this procedure is through that catheter, we're placing a little wire. So in this case, we're trying to place the wire into the sinus just above the eye there. And so first time he misses, and then the second time here he gets it right through the natural opening. So we're just going through the natural sinus opening there.
How big is that wire?
The wire is about the size of a pencil lead, so real thin, as thin as you get. And it's very flexible. And then the balloon expands, which just expands the natural opening, and we deflate the balloon, and all that junk comes out of there.
It's like a cardiac
Exactly.
catheterization.
It's the same exact
angioplasty.
Angioplasty balloon.
Okay.
Exactly.
Okay.
Exactly.
Okay. And so the key being there is, you know, I'm sure that most over-the-counter remedies can't get all the way up in there because
Right.
it's so small, right?
Exactly. Yeah. Exactly. Well, when people have sinus trouble, it's almost always because of the anatomy. And so if the anatomy is shut down, then you get a sinus infection, or you get the sinus pressure headaches. Either one.
So that's just a mechanical thing, and you can do that. Do you need any sedation for it?
Typically, we do it with people asleep, just to get them out of the equation. It doesn't take very long to do, and most people are able to return to work the next day.
I find that nose, there's some sort of primeval reaction to someone being around your nose. Is that true? Is there like a reflex? So you don't want the patient going bang?
Exactly. No, exactly. I mean, that's usually the reason why we put them to sleep, is because, it's right in the middle of your face, and even though it's not particularly painful in the moment, it's just it's something happening right there, and your body wants to react to it.
Right. And how does this compare in cost to maybe a sinus surgery?
It's usually a lot less because it's less time in the operating room, less of what we're doing, and we're usually able to keep it very focused as far as the sinuses we're working on.
And Dr. Kandula, can you tell us where you're located for people who want this procedure and are interested in your practice and contacting
Sure.
you?
We are located in Wauwatosa, just at the corner of Watertown Plank Road and Mayfair Road.
And it's called Advent, Advanced Ear, Nose, and Throat Specialist.
Correct.
Thank you so much. And Michael, thank you for sharing our experience with us. Michael Deemer,
My
we
pleasure.
appreciate it.
Thank you. Thank you for
Thank you
having
very
us.
much. I think it's a very interesting procedure. I think I'll be checking it out myself. Still ahead on our show, how international adoption affects the